Welcome to an introduction to the Michigan Public Health Institute's Center for Healthy Communities. Today, we will cover a brief overview of the public health coaching and advising services that the Michigan Public Health Institute, or MPHI, provides. To start with, let's review how MPHI was established, as well as provide more specifics about the Center for Healthy Communities, or CHC. MPHI is a 501c3 private nonprofit organization incorporated in 1990. Our staff includes researchers, data analysts, evaluators, and scientists who are trained in a broad array of health fields and have extensive experience in community-based work. MPHI is a unique blend of public and private sector resources and is governed by a multi-sector board of directors. All of MPHI's work is driven by its mission to advance population health through public health innovation and collaboration. Our role is to carry the voice of communities to policymakers and the scientific community, to advance the application of scientific health practices in communities, and to advance community capacity to improve health and reduce disparities among population groups and geographic areas. That is just a brief summary of MPHI on a company level. Now to dive into more specifics about CHC. The Center for Healthy Communities, or CHC, within MPHI works collaboratively with our partners to transform public health systems and improve the health of communities through assessment, evaluation, and continuous quality improvement. Our program specialty is in applying a community-based, capacity-building approach to strengthening public health services and systems. Our education, training, and experience lies in working directly with diverse communities and partner agencies across many different sectors and at all levels: local, state, federal, and tribal. While our multidisciplinary staff have many areas of expertise, the program offers specialized knowledge, skills, and partnerships in public health improvement, tribal health and wellness, and maternal child health. Within its commitment to the communities served by public health programming, CHC deploys a model of support to partners that we refer to as public health coaching. Previous and current partners have benefited from their relationship with CHC coaches through exposure to our strategic coaching cycle. Within this model, CHC coaches are able to respond to community-specific needs, build efforts into a community's unique strengths and potential for growth, coordinate planful and informed actions, create opportunities for learning that are intentional and the driver of next steps, focus and coordinate all efforts toward long-term capacity building within our partners. Here at CHC, we are proud of our approach to partnership. We have worked over the years to hone our skills in collaboration, and we pride ourselves on prioritizing the needs, desires, and interests of our clients and the communities they serve. Our partnership philosophy involves working with clients or community partners to fully commit being a community and customer service-driven contributor. We believe that those closest to the communities that we work with are the true experts, and their wisdom drives the work that we do. We aim to bring useful and tested strategies, tools, and supports to help our partners meet their self-defined goals. CHC's public health coaching team helps partners know what they can lean on us for, how we can support their work, and most importantly, that their coach is ready and willing to jump into a direction valued, needed, and directed by our partners. Another tenet of our approach that makes us unique is our flexibility. Our support is available to our partners however they need it most through the entire course of their work, whether that be from project start to finish or on an as-needed basis. We aim to meet our partners where they are and how they define their coaching needs. The Center for Healthy Communities has years of experience demonstrating our responsiveness and flexibility. Our coaches are comfortable and tested in dynamic situations. In the ever-changing environment of public health, we have learned to be nimble and ready to respond, sometimes even switching directions at a moment's notice. A final tenet of our unique approach is our notable depth and breadth of knowledge, skills, and tools. CHC coaches include a diverse staff with extensive knowledge, skills, and backgrounds. From social workers to public health professionals to quality improvement specialists to data analysts, the CHC coaching team consists of a unique staff with deep toolboxes, so to speak, to support public health change and improvement. Our approach is guided by our exposure to the on-the-ground reality of community health improvement. We understand that while models of improvement are depicted as linear or cyclical, the reality is that community health improvement is dynamic and ever-changing. The needs, the players, the resources and opportunities, and the challenges are different from community to community and within the same community over time or in different settings. This complexity requires the adaptability and willingness to learn first that our coaches bring to every situation. We work with communities to build health improvement strategies that are continuous and iterative. Community health improvement doesn't stop or start, but rather happens on an ongoing basis around emergent needs, and in every iteration, they get better. We rely on a broad and deep toolbox and set of competencies in both the process of improvement, from engagement to assessment and planning, to implementation and improvement, and in the context of improvement, from various health outcomes and behaviors to social determinants of health, to the provision of services to addressing the broader system and context. We look to the science of improvement as well as the practice-based knowledge of the community and state leaders who have created change but not written down how they did it. At its best, community health improvement is inclusive of a diverse set of partners, which bring resources and opportunities as well as challenges. Our coaches understand the benefits and challenges of engagement and support communities through navigating these complexities. With these concepts in mind, CHC coaches are ready to deploy their knowledge, tools, and on-the-ground experience to help our partners prepare and experience the system-level changes they are looking for. Let's take some time to understand the specific ways in which CHC coaching adds value to our partners and communities. Overall, CHC's coaching support can be broken out into 4 main clusters of activities. As proven with past and present projects, our partners and communities can benefit from our unique expertise in assessment, planning, and implementation, performance measurement and continuous quality improvement, or CQI, sustainability planning, and evaluation and data support. First, we'll take a deeper look at the ways we support assessment, planning, and implementation. CHC has years of experience under our belt leading, supporting, and consulting on projects related to building capacity in assessing communities' needs, creating detailed and thoughtful plans across partners, and putting those plans into action. This includes, but is not exclusive to, supporting assessment and planning processes, including formal community health assessments or community health needs assessments, community health improvement plans, strategic planning, and less formal assessment and action planning. Convening and facilitating stakeholder gatherings and group development to support rich stakeholder engagement and robust partnerships. Identifying, adapting, and implementing evidence-informed practices. Supporting health impact assessments and working toward a health in all policies approach. With a comprehensive portfolio of experiences related to capacity building in assessment, planning, and implementation, CHC coaches are well practiced in combining their knowledge of public health systems with a vast toolbox of diverse skills and methods to support change. From extensive statewide needs assessments to programmatic strategic planning, CHC can use its experience to help our partners know how to plan for change. CHC coaches are well-versed in helping partners identify a comprehensive spectrum of stakeholders to include in conversations about change and are comfortable and prepared to lead a group of stakeholders through exploring various types of data, using it to select priorities, identifying effective solutions, and overall putting into action relevant ways to enact the changes they aim to see. As an added bonus, the majority of CHC's coaches are trained in the technology of participation facilitation methods, which deepens our ability to convene groups in a neutral, positive, and consensus-focused way. Next, we will take a look at performance measurement and continuous quality improvement, which is a strong area of expertise within CHC. Performance measurement and CQI is a main component of many state and federal grant programs, and CHC has a high degree of experience supporting projects and initiatives with these components. CHC utilizes the PDSA, or Plan, Do, Study, Act, methodology for approaching improvement efforts, has 2 certified quality improvement associates currently on staff, and has 3 staff trained in the Institute for Healthcare Improvement's Breakthrough Series collaborative model, which is another model for improvement. CHC coaching staff can provide support on identifying performance measures and monitoring processes, supporting the development of a CQI plan and a CQI council, training partners and communities in CQI tools and methods, providing ongoing coaching for plan, do, study, act cycles, using CQI tools on a routine basis, such as using process maps to deeply understand existing and ideal processes. The CHC team is well versed in methods, tools, and on-the-ground application of quality improvement. From training those completely unfamiliar with QI to leading expert teams, CHC is ready to meet communities where they are in exploring ways to raise the bar and improve processes towards achieving better outcomes. MPHI's extensive experience supporting quality improvement efforts is rooted in a desire to help communities and programs solve their problems from within using data-driven, structured, and evidence-based methods. Next up is sustainability planning, which is a necessary component of today's public health landscape. Many partners need coaching and support to maintain the critical work they are doing, particularly when facing time-limited funding opportunities. CHC coaching can support planning and action to ensure that activities can extend past the end of specific lines of funding. As with all of its work, CHC coaching support of sustainability planning is always tailored to the unique needs, desires, and interests of each partner we work with. Some potential areas of support include supporting planning conversations, developing communication strategies, identifying ways to engage or more deeply engage community organizations, businesses, and other partners, strategic planning, structuring and restructuring governance, building community support, identifying sources of funding. Coaches are ready and able to guide efforts to understand and plan for program sustainability. Depending on the needs of a program or a team, we can help get stakeholders on the same page regarding components of program sustainability. We can help assess priorities and gaps in sustainability, and we can assist in the development of targeted action plans for sustainability planning and preparation. We know that sound public health practices, decisions, and change are based on a strong foundation of data, and that evaluation is an everyday part of good public health work. CHC coaches can help partners identify, collect, and analyze comprehensive data, both qualitative and quantitative, that can improve decision-making. CHC coaches frequently provide support to partners in their data collection, management, analysis, and reporting efforts, specifically developing a logic model and evaluation questions, selecting an evaluation design and methods, identifying existing data and collecting original data, troubleshooting issues with data collection, compiling and analyzing data, making data meaningful, displaying findings in clear and engaging ways. CHC understands how to make evaluation work for our partners. Our approach is focused on ensuring that all phases of the evaluation process are community-driven and that the evaluation is designed to be useful. CHC also understands data, from conceptualization to collection, analysis, and reporting. We are well experienced in developing surveys, focus group protocols, and facilitating interactive data collection methods. Our skilled coaches can assist a partner in setting up a system and plan to manage and analyze data in meaningful ways and create products and reports that are accessible to target audiences and ready to be applied to decision-making. This has been a short summary of the ways that CHC coaches are working to support our partners and overall the public health system, both local and national. Our staff are well-versed, professional, creative, and have a vested interest in working with partners to support and leverage the great work already going on in the communities they serve. CHC coaches are ready to support current and future partners on the ways defined in this presentation and more, and we have the knowledge, resources, skills, and tools on hand to support partners in their efforts to make a positive, meaningful change within their systems of public health. Thank you for taking the time to learn more about MPHI as a company and about CHC at the program level. Should you have any questions about our work, please do not hesitate to contact our program director, Dr. Julia Heaney, at jheaney@mphi.org or by calling 517-324-7349.